In August this year, the Kenya Medical Practitioners and Dentists Council, KMPDC, launched an investigation into health facilities nationwide, mainly to ensure compliance with medical standards and licensing laws. Two Gazette notices, numbered 12178 and 12179, dated August 28th, followed, deregistering at least 998 health facilities across various counties. Despite this major crackdown, investigations by NTV reveal lack of enforcement, as some of these facilities have openly defied the closure orders, leaving Kenyans vulnerable to life-threatening malpractice. NTV's Helen Aura with the details on tonight's episode of The Monitor.
The gazettement of 998 deregistered health facilities across the country reveals the rot in Kenya's health sector, as some of these facilities have blatantly defied the closure orders. The Kenya Medical Practitioners Dentists Council cited that these facilities lacked valid licenses or registration, had unregistered practitioners, and also lacked proper waste disposal systems. Tucked along a dusty stretch in Shauri Moyo Estate, Shauri Moyo Medical Center remains open despite being one of the facilities unlicensed by KMPDC. Pretending to be a patient, I was ushered into the consultation room. First, I am appalled by the hygiene levels here. The stained tile floors and dusty environment is an indication that the sanitation levels are questionable. I noticed that the walls have conspicuous brown stains, a clear indication that it has not been cleaned in a while.
Wewe ni daktari, clinician, ama?
I'm a nurse.
You're a nurse? Okay. So if I wanted to see a doctor, ako around, ama?
Yes.
But utakuwa na kwanza wewe. Ama?
Haina shida kama like unajua inategemea na specific case yako.
Okay.
So kama nesa kusaidia ma we do another thing.
An indication that they have been receiving patients.
This facility we usually offer like we just work like level 1.
Okay.
Yeah, level 1 is ni mali wenye mtu akikuja. Unaleta chief complaints zako. Tuna deal nayo kama ni ile case kubwa sana, tunakuambia tunakurifa uende mahali. Because unajua sasa juu imeanza juzi, hatujakuwa na ile equipment ya kutosha, especially hata kama lab vizuri. Ukiangalia lab ni hizi tu vitu zenye tunatumia sasa hivi. Ni hizi vitu ndogo kama hizi kama malaria test, yeah, PMTCT test, HIV test, yeah, pregnancy test.
When I asked directly about their status with KMPDC,
waliwaambia nini?
Sasa hizi ndio tulikuwa tumeenda huko. So wakatuambia you just go and kwanza kwa mambo na public nini hiyo watu wa public health kwanza. So tutakuja wa confirm kama environment iko sawa, kila kitu iko sawa. So that sasa after hapo wanatuandikia barua. So tatio barua tu tuelekee huko dunia.
So na sasa hii facility iko na license, iko registered?
Yes, iko registered because unajua we are just in a process.
Because of this, the facility only attends to patients who pay out of pocket, I learn. Our quest further leads us to Eastleigh 10th Street, to Mahash Dental Clinic. It is located inside a cream-painted building. Two men sit outside the building taking note of who is going in and out. Again, I pose as a patient.
What would be the cost of treatment now if you couldn't?
Cost of treatment, 10,000 unalipa mara kwanza, and then 1,000 per job for cheap.
And a fresh set of braces unapanga na how much?
Fresh set tunapanga na 20 per job. 20,000.
This clinic is among those whose licenses have been revoked. They inform me they perform all dental procedures at fair prices. I proceed to reveal my true intentions and question why they are still operational.
Bado mnaweza endelea kuoffer services hadi wakati
sisi tumejipanga kila kitu tumetengeneza and here tumeapply.
One thing we would want service providers to know Yes, that operating outside of the regulations and law is actually criminal. Even where they may think they were trying to do good, it is a crime.
Unajua ukifunga hapo unajua ni shida, wewe pia unajua vile hali iko, wewe ni journalist ndio, so unajua vile hali iko hapa, unaelewa hapa ni range na kufunika kazi kama kazi kama kitambo.
According to the Medical Practitioners and Dentists Act Cap 253, unregistered and unlicensed premises, Kenya Medical Practitioners Dentists Council, in accordance with Section 5, Clause 15 and Section 22, Clause 5, closed 998 facilities for being used as health institutions without being registered or licensed. Nairobi County is a leading county with 474 closed facilities, followed by Mandera with 128 closed facilities, Homa Bay 128, Kisii 116, Wajir and Nyamira 77 each. Dr. David Kariuki, KMPDC Chief Executive Officer, stresses that there has been a crop-up of unlicensed facilities that are offering services to unsuspecting Kenyans.
The dangers that maybe people may face is either misdiagnosis or delays in treatment. It depends on the reasons we had closed. If it were reasons for infection prevention, then maybe risks of further infection when one visits such places.
KMPDC further says they had put a closure notice on the door of each facility, and they are the only ones who have the right to remove the notice.
In these cases where people have reopened without authority, now that is also a crime. We should close them, and we are working with the county governments and the county commissioners to help us keep tracking those places.
On many occasions, the Kenya Dental Association has raised concerns about the rise of fraudulent dental clinics following cases of reported botched procedures. As KMPDC intensifies its crackdown, 998 facilities remain under scrutiny for failure to meet the required medical standards. For KMPDC, it is a matter of protecting patients from unsafe services. For Kenyans, a reminder to seek services from licensed facilities. Helen Aura, NTV.